have literally held 132 hearts in my hand, and at that point I thought that was my most rewarding job. This working with Sonus has far exceeded that. My name is Laura Marshall. I am the Director of Nursing here at Sonus Home Healthcare. I have been a nurse for 24 years. My very first job out of nursing was pediatrics. And one of the things that was most stressful for me is that it was in a hospital. And you took care of 5 patients, and some of them were very fragile, trachs and G-tubes, and it was very hard. You felt overwhelmed. And what I love about Sonus is you have one client. Now I know DONs, they have managed all the clients, but from the perspective from the nurses, you have one client and you can develop that relationship. What I typically do on a day-to-day basis is I meet with the nurses. I may teach them how to use the computer. I may teach them how to document. Most of the time I'm in the home helping them learn their clients. If there's pieces of equipment they aren't familiar with, I'll help them with that. Just help them get comfortable so that they can have a very easy shift with their client and they're comfortable. There's so much we do. So as a DON, my week would look like I could be doing a start of care, I could be doing a recert. I also meet with each of our nurses for a skills validation during the hiring process. We will Zoom and I'll just ask them a series of questions. It's very comfortable. I treat nurses the way I want to be treated, to kind of help them relax a little bit. I tell them a little bit about Sonus. I also tell them a little bit about what to expect moving forward through the hiring process, and then we get into skills validation. If they are anxious, then we stop and we'll have a little bit more of a conversation, and then we'll get right back to questions. Sometimes I'll just give them a scenario that will cover a lot of the skills that we need to validate. Just kind of assessing their learning type and then incorporating that into our skills validation process. Sometimes we have to have that conversation between the nurse and the family. Sometimes the nurses aren't comfortable having conversations with some of the families, so they'll call us. We'll walk them through that, and then families will call us, and they will say their piece, or they'll say, tell us what's bothering them, and we'll kind of be that middleman. My favorite part is when we get to go to the home. It's beautiful getting to experience the visit with each client, because most of the time when they're in their home, they're comfortable. You get to see their real personalities, and you get to see the interactions with the parents and the child and the nurse and the child. So that's my favorite part. Sometimes when a nurse is being assigned to a client, we will call the nurse and review the plan of care with the nurse. We'll review the equipment that's in the home. We'll review some of the therapies that are in the home, and have that opportunity for the nurse to have that question and answer session. We want them to go to the house prepared, so that when they're in the home, they already know the equipment, they already know the medications, they know a little bit more about the patient, so that interaction can be a lot more personable. So I think Sonus is very good with advancing your skill set. They believe in teaching. Where there's a challenge or a deficit, you can call anyone in leadership and ask, can you explain this to me? Can you walk me through this process? What does right look like? And they are very eager to help you.